You are listening to the Critical Mass Radio Show, Orange County's business talk show, focused on exploring topics of interest to CEOs who are leading middle market companies. With your host, Richard Franzi.
Hello and welcome to Orange County's longest running business talk show. I am your host, Rick Franzi. We have a very good, if not great, show planned for you this afternoon. Why do you ask? Because Mark Beran is our guest. Mark, welcome to the program.
Thank you, Rick. Really appreciate you having me on the show.
Well, let's get it started by, you've had a great career in a variety of firms, mostly in the healthcare field. So take us on that journey. How did you get started? What are you doing? Just bring us up till today, and then we can talk about what you're currently doing after you kind of take us on a journey.
Yeah, I appreciate that, Rick. So I think probably like a lot of your audience, I actually started my career at a startup, and I had the benefit of heredity. So my father started a little startup business called Respiratory Support Products, and I actually started to work for him in part-time in high school and college. Got my degree in marketing and went to work for the business full-time, and he and I were able to build the business up and then have a successful exit. And we sold it to a British company called Smiths Medical. You guys, I bet your audience knows Smiths, but doesn't know Smiths. So like anytime you go to the airport and you're putting your bag through that X-ray equipment,
sure,
it's primarily Smiths. So they made that equipment, but they had a pretty substantial medical division, about $1 billion in revenue, and we were tucked into that, and kind of scaled the business within the platform of a larger parent. The business was very much autonomous for the first 10 years or so. And then I used that as an opportunity to kind of scale my career at Smiths, and went on to head up sales and marketing for their largest division in the patient warming space, a company called Level One, and was successful in doing that. And then from Level One, went down the path of general management. So I'd always done kind of sales and marketing, and I moved to a full P&L role, which is always interesting, Rick. And I'm sure members of your audience have done this, where you think when you move from sales and marketing into general management that you could fix everything with revenue, and that's really not the case, right? You have to kind of understand fundamentally what's going on with the business, where are the holes in the business, and where can you execute to drive the business to profitability and success. And, I was able to do that. I really got a team, put a good team in place that was aligned around making the business better. And that was a fun business. We made products for warming and cooling patients, and we dove into an emerging market of therapeutic hypothermia. And I don't know, Rick, if that's an area that would be familiar to you or not, but
I'm curious, what is that?
Yeah, at the time, the science showed that if you, God forbid, you had a cardiac arrest, if you induced mild hypothermia, the neurological outcomes were substantially better. So if you induced hypothermia, somebody would come out of the cardiac arrest with no neurological damage, which was a really big deal. And so we gravitated towards that. We built KOLs around that opportunity, actually hosted a trade show that was international for scientific presentation on basically cooling post-cardiac arrest. And it was pretty dramatic for the business. And from that business was called Cincinnati Sub-Zero. I came back out here and headed up sales and marketing for a local company. Am I taking too long?
No, I was laughing at the name. I assume you were in Cincinnati for that.
I was, yeah.
Okay.
Yeah. I headed up sales and marketing for a business called Posey, where I was senior VP of sales and marketing, and headed up sales, marketing, and product development for that business. And that business was in the patient safety market, made products for basically keeping residents in a senior living facility or patients post-surgery safer. So products like fall alarms, and they made restraints as one product category, which was pretty interesting. And then for Posey, I got my first foray into the middle market private equity owned businesses. And I became general manager of a business called Gamar Industries in upstate New York. And Gamar they made pressure ulcer management products, which is a fancy way of saying basically therapeutic mattresses or support mattresses, anything from foam to high-end, high technology surfaces. Stryker was our largest customer, and myself and our management team executed a successful sale to Stryker and sold that business. And then that kind of gave me the first glimpse of the private equity experience. I actually got networked in through that company, through one of the private equity sponsors, to a company called Tidy, and I was chief commercial officer there. And Tidy probably is a company that the name doesn't ring a bell with you or your audience, but I guarantee you and your audience have used a Tidy product in the last year. So anytime you would go in for a physical in the doctor's office and you sat on the exam table, that barrier paper between you and the exam table, about a 70% chance Tidy made that. And then a month later, when you went in to get your teeth cleaned at your dentist office, that bib that they were hanging around your neck, about a 70% chance Tidy made that as well. And so my role there from the private equity sponsors was to really, as chief commercial officer, build out both an organic and an inorganic strategy around the acute care market, because they were heavily indexed in both physician office and dental. So they needed an area to grow the business and really provide a growth story for the business upon the next exit. At Tidy, was successful in doing that, grew the business both organically and inorganically. We took revenue from a little under 120 million to almost 200 million in less than 5 years, and doubled EBITDA at that in that time frame. So the sponsors were pretty happy with that outcome. And I worked for 3 different private equity sponsors in that one business in 5 years. So went through the transition of kind of learning what the hot buttons were for a new sponsor, and delivering results, basically aligning the results around that theme. And then most recently, I was chief marketing officer for a company called Encompass Group down in Georgia that does healthcare textiles, mid-market, couple $100 million in revenue, does healthcare textiles, does staff and patient apparel, and then does patient warming products and support services as well. So kind of brought that into play. I think I'm proudest at that particular juncture. I led a team that built out 2 new product categories for Encompass, and we ended up generating 9 patents on those 2 different products, and brought both products successfully to market. And then most recently, I've been working as a fractional chief commercial officer for a company called Gales. And Gales makes the first ever PPE nurses shoe. So they have a shoe that's antimicrobial. It's sealed. It really kind of addresses the concerns of the healthcare environment for a nurse. And before Gales, a nurse would basically be wearing trainers into on the floors as they were a nurse. This is a product really designed for the environment they work in. And then I'm also engaged in marketing a business in the vascular access space. And I'm actually in the throes of shepherding a sales process for a small startup called MightyWell that makes vascular access products, particularly sleeves for protecting a patient that has a PICC line.
So you've been all over different aspects of the healthcare field in your career, and it sounds like you've been in a number of different physical locations as well.
That would be true. Yeah, I started the career here in California, moved to the Boston area, moved to Cincinnati, Ohio, moved back to California, and then back to Boston, and then finally to Wisconsin, and then Georgia.
Yeah. So you've had a chance to see how business is done in different cities, and now you're able to be back here in Southern California, which I would assume is a benefit to be back in Southern California after some of those other
Yeah, just the weather aside is a benefit compared to shoveling snow in Wisconsin.
So when your father started the firm and you began working for him, did you envision this as your career path, or was it just a series of well-timed moves that happened? How did that?
Well, I had a real passion for it. I mean, my father was a cardiopulmonary physiologist, so I got to see what he was doing. Yeah, when I was a 10-year-old, he'd have me in the lab spitting blood samples, and so I got exposure to that at a very young age, and I really respected what he did, and I respected the notion of making a better life for patients. And without probably stealing your next question, I'll give you a little anecdote about that. So my first son was a preemie. So he was born about 2 months premature. And I remember my wife talking to the neonatologist. And the neonatologist said, we want to use this new ventilator on your son, Joe. It's called a high frequency ventilator. So my dad was a cardiopulmonary physiologist, did work with neonates and preemies. And so my wife naturally called my dad and said, well, what do you think?
Right.
And he says, well, I developed that product.
Jeez.
So the product that was being done or used on his grandson that allowed his grandson the opportunity of being here today, his granddad developed.
Wow, that's pretty awesome.
The impact that you have in healthcare with the capability of delivering, life-altering, family-altering products is pretty remarkable. So it's really a privilege to be able to do that for a living.
Yeah, that's a great story. Thank you for sharing it. I'm wondering for the different companies at the different places that you've been, did you find that there was much overlap in maybe the client base, the supply base? I mean, were you able to find that you could take a lot of what you knew and who you knew from one position to the next?
Yeah, very much so, Rick. So if you looked at it, like a lot of what's going on in healthcare, there's large distributors involved, right? So that the customer base was very common in terms of who would stock and distribute the product. Group purchasing organizations, which is a dynamic that you have to deal with in healthcare, that was a common thread, really, with all the businesses I was with. So that's a good observation. And even from a supply chain perspective, there are crossover vendors that service, that provide unique services that I would use at multiple stops.
It was interesting when you made the observation earlier that when you got your first general manager's position, coming from a sales and marketing background, thinking that revenue cures all ills, the realization that it doesn't. And sometimes it can actually create more problems if the company isn't set up properly.
Right.
I too came from a sales and marketing background to be the president and kind of general manager for an operating division of a large manufacturing company. And I came with that bias as well. And it didn't take me long, as I'm probably sure it didn't take you, to realize that the level of detail that you have to get into when you're responsible for the whole business is much more complex than when you're just driving the sales and the marketing messaging around that.
Yeah, I became a very good friend of my controller.
Mm-hmm.
And I remember she and I basically, and I couldn't figure out what the heck was going on with the business. It had decent margins, it was losing money. And she and I dissected the P&L and we carved it back. We found two things that were killing us. It was warranty cost and it was R&D. Mm. So, and that's hard to hear for a startup, right? R&D is like the lifeblood of a startup. But
right.
As you get into kind of a more mid-sized business, there has to be an expense that you look at in the context of your overall expenses and your overall revenue. And this business was not, so once I got my arms around those two facets, I was able, with my controller and my team, to pretty quickly turn the business around.
And to see the interconnections between the different disciplines within the company is more acute when you're the general manager than when you're the sales and marketing advocate.
Yeah. In sales and marketing, sometimes you're dumping your problems on those resources, right?
Figure it out.
When you're the general manager, you've got to figure out how to shepherd all those resources and get them to pull the oars in the same direction.
Yeah. because it's great to get the revenue, but it's better to make a profit.
That it is. Profit's king, right?
Yeah. EBITDA, some level of positive financial performance, because, it's having been in organizations where you can grow the top line, but you're making the business less valuable because you're deteriorating the bottom line.
Right, exactly.
And so top line revenue doesn't cure all ills. Sometimes it can exaggerate a problem that's already existing in the company. I'm wondering, from your perspective, what has changed in the healthcare field over time, Mark?
Yeah, there's quite a bit that's changed. I mean, I think most recently you could kind of look at this, the influx of technology maybe at a high level. And, I think the pandemic caused a lot of issues, right? And, we had tremendous loss of life in this country, but there were a couple of good outcomes from that. I think, as a, for instance, the embracing of telemedicine, there is no way we accelerate embracing telemedicine probably by 10 or 15 years with the pandemic, because it forced using that technology in a way it was intended to be used to solve a problem. And even what we're doing now, where we're on a virtual meeting, right? We weren't doing that pre-pandemic. If you look kind of specifics, you look at kind of, I'm really curious to see how 3D printing and some of the technologies that have emerged in the last 5 years or so really impact real-time solutions for critical problems. So if you look at it, I think at some point the orthopedic companies will be making a Rick hip or a Mark hip, and our implants will be very much geared towards us and unique. There's probably regulatory hurdles they need to get through to do that, but I think that's very much that's going to happen. So the influx of technology has really been, I think, dramatic, and in some cases in a very good way.
It seems to me too that the healthcare, as being a slice of GDP, is so significant that there must be, and there continues to be, interest from outsiders to get into that market, whether it be through private equity or venture capital or whatever the sources of flow of money might be. But it feels to me that the healthcare industry is still an attractive area for investment and development.
Yeah, I would agree with you. I mean, if you look at private equity groups, they're always trying to figure out, they're risk adverse too, right? So they want to make an investment, but they want to make an investment where you don't have as much risk. So class 3 med tech is a little risky for a private equity group, but low tech med tech isn't, and they're very, very focused on that. Very focused on, I would call them strategic OEMs for larger companies like a Stryker, for instance. So companies that manufacture a component of something that's used in an orthopedic device is very attractive to private equity groups. But from an investment point of view, healthcare is a really attractive space because, as you've already mentioned, it outpaces the GDP in terms of growth. And it seems even when there's an economic downturn that healthcare is far less impacted.
Interesting. Your father was both a doctor and an inventor / entrepreneur. Are
Yep.
you still seeing those type of people in the healthcare space?
You are, but I think that personality has changed since my father started. And I think, the analogy I use is years ago when I went to my first anesthesia trade shows, right? Every other booth was a little startup that had something they were bringing to market. Well, because of less complexity from a regulatory perspective, an easier means of bootstrapping your business, you could start a business in medical device healthcare 30, 35 years ago with nominal investment. Now the CEO of a startup has, their full-time job is raising money, right? And so it goes from the creative, let me spend my time on innovating this new product, to I've got to raise capital immediately to provide the means to get the product to market.
Yeah, that makes sense. Let's turn our focus to the future. Where do you see, what do you want to continue to do? What role are you wanting to play in the healthcare space?
I like what I've been doing now. I mean, the ability to help startups is pretty appealing to me. This gray hair, I guess, gets me a little respect from some of the startups that I've kind of bruised myself, and am able to give some guidance that's material and adds value for them. So this opportunity to be involved with folks that have a dream and a passion and want to make patients' lives better from a early stage part is pretty interesting to me, and I'm enjoying that. So I intend to continue down that path.
Are you going to stay in Southern California, Mark, or could someone talk you into moving again?
It would take a lot to talk me into moving.
Okay. If someone would like to connect with you or learn more about you, where do you suggest they go, Mark?
They could certainly go. I'll give my email if that's all right.
Yes, please.
Yeah. So my email is Mark, M-A-R-K, V as in Victor, Beran, that's B-E-R-A-N, @gmail.com. And you can also look me up on LinkedIn.
Well, I've enjoyed this conversation with you. I've been looking forward to talking with you this way since we first met. So thank you for giving your time today to my audience.
All right. Rick, I really appreciate it. Thank you so much.
You're welcome. I'd like to also thank the audience. You've been a part of Orange County's longest running business talk show. Mark's episode was episode number 1412 in our catalog. And if you're an Orange County entrepreneur and you would like to tell your story, then reach out to me. I'm Rick, R-I-C, Franzi, F-R-A-N-Z-I. You can also visit my website, which is the same thing, rickfranzi.com. Until the next time we have a chance to be together, I hope all of your business decisions move your company in a positive direction.